What's up, everyone? This is your daily dose of mental health, and in this video, we will be discussing the topic of addiction and um, some different perspectives on it. And I've been reading some different perspectives on it that I think should be addressed, and that I think Western medicine in particular is missing. That could be a real game changer. For people who have drug addictions or other addictions like gambling, you name it. There's addictions in everything. This is your daily dose of mental health. Please like and subscribe to the channel, but I want to go ahead and get right into it and keep this video hopefully under 10 minutes. So when you look at the topic of addiction in general, a lot of people immediately, and I work in a psych facility and I work as an RN, we always look at, and in particular, the psychiatrists look at the symptoms. So let's say a patient comes in, they're withdrawing from heroin, or they're withdrawing from heroin or want to get clean from heroin, or you name it, meth, whatever. And they look at it and they're trying to treat the symptoms, start them on medications, which is nothing wrong with that, but that's typically how it starts. They go to groups for coping, and they learn some coping skills. However, one thing that I think is a key piece that is being missed, that is not discussed enough, is understanding and teaching people and patients, the patients in particular who are suffering through the addictions, which I've been through my own addictions, so I can say this is true, before we start treating the symptoms of the addiction, we need to recognize if the addiction is stemming as an origin from trauma. From what I've seen, trauma is what I've seen the number one cause of somebody developing an addiction to whatever it may be. Because if the trauma is not recognized, if it's not recognized or discussed, that is potentially, which is the primary reason that needs to be discussed, that would potentially lead to the addiction as being secondary. Because if you're not treating the underlying cause of the addiction, the base of it, meaning the trauma, you're just sugarcoating the tops of it. Yes, you might take off some of the side effects by just treating, oh, okay, these are the signs and symptoms of the withdrawal, but you're not getting to the heart of it, which is what caused the addiction in the first place. Another question I like to pose is, if trauma does not play a role in the addiction, should it be treated differently? So in other words, if somebody's telling you they can't think of any trauma that is playing a role in it, do we just go straight to treating the addiction on what they're going through? Okay, here's the signs and symptoms. This is what will be best for you. This is what will make it the easiest for you to transition back to normalcy. That is the main thing that typically in today's Western medicine is being done, regardless, but they're not asking the question about trauma. And you'll notice people come back in over and over again, they relapse, and they're not looking, as I've said, they're not looking past, okay, they're addicted to alcohol, they're addicted to this, okay, let's treat the symptoms, they're going to groups, they're not addressing that concept of trauma. Another question that I like to pose and things that interest me, there's a guy, Gabor Mate, who discusses this more so in depth, the idea of trauma and how it really does play part with the addiction. Here's a question would be, did you or your family value something that led to negative results, leading to a disconnection, which could have caused the trauma? So a lot of times there's families, let's even take the idea of, let's say you have your family has a family cultural tradition, they're expecting you to carry out. and it's something that you're questioning not wanting to do, and it's causing you to feel more depressed because of it, over time. And if, as a child, they're expecting you to carry these out, it can start leading you down that route of disconnection, which in a lot of cases people don't realize it. When you're fighting something you're not wanting to do, which your parents are telling you, then they're telling you, well, if you don't do this, then you're going to be a disgrace to the family. A lot of times, unless you discuss this with the patient, they don't know this, that is something that can cause trauma, which can lead to addictions. Another thing, this is one of the biggest things that I've realized, that I've taken away, is addiction is always an attempt to solve it. It is always an attempt to solve a problem. I'm going to say it again. Addiction is always an attempt to solve a problem. And remember, it's not the primary problem. So why aren't we looking at the disconnection, which is the primary problem, which would be the trauma? So let me state it. Addiction is always an attempt to solve a problem. However, that's not the primary problem. That can be the secondary problem. The disconnection, in whatever way it is. Now, also as the trauma, that is the primary problem. So as I said earlier, if you're not addressing the problem, and you're just looking at, oh, this is the addiction, let's treat the addiction this way with this, this, and this. If you're not addressing the primary problem, which is the trauma, also known as the disconnection. And I use the word disconnection because a lot of times the disconnection is something that is, as a kid, as I said, let's say your parents are wanting you to do this, this, and this, and you're fighting it, and don't want to. That's the disconnection that's being formed. Your brain is going through that neuroplastic change at such a young age, or even as you get older, that disconnection is what is leading, which is the primary problem, which is leading to the addiction, which is the secondary problem. And the secondary problem is what a lot of times psychiatrists are treating. And I'm not blaming it all on the psychiatrist, but it goes back to, from the not only the psychiatrists, the nurses, the therapists, understanding that we need to be looking at what the primary problem is, which is the disconnection. And another thing is, I've always kind of pondered, or why are we looking at treating the symptoms? And this kind of sums it up. Why are we looking at treating the symptoms and not looking at the root problem? And that's kind of a summary of what I've been saying. Because if you're just treating the symptoms of whatever the addiction may be, okay, that might help short term. Some it might help long term, but the reality is if you're not getting to the root of the problem, it's going to continue, and it could continue to get worse. So that's just some things to think about. I've thought about that, and I work in mental health. And that's one interesting thing I've been looking at in regards to things like psychedelics. I've never done psychedelics, but sometimes you really have to dig deep to see what stressed you out when you were younger. Was there something like that? And I've been reading more and more, which I'll do videos on in the future, about the power of what psychedelics can do. And I don't really feel comfortable doing a video on them until I've actually personally done them, because I've heard they really do help you understand what that disconnection was inside, and can cure depression, cure anxiety, can cure that addiction. But I don't really want to go too much more into that, because I need to do more research into it and try it myself in the future by if a shaman lead it or whatnot. Remember, I will be doing a video, 5 natural remedies that can make meth withdrawal easier, sometime this week. Look out for it, Wednesday or Thursday, the video. Because I'll put the link to the other video of what I put, kind of what to expect if you're going through meth withdrawal, if you ever go to a psych facility, or if you're being treated in a healthcare setting. I'll put that link, but look for the one next week about meth withdrawal and natural remedies. And I've personally not used meth, but I can tell you, working in a psych facility and detox facility as well currently, things that have helped patients, if they don't want to go the medication route. So look out for that. I know this is kind of a random video that I threw out here at night, but it was just stuff I was pondering and reading about. And I always like to think about knowing that I've had my own addictions in my past to tramadol and drugs, and and I've always been trying to look at why am I more prone to it than somebody else? Because I've always thought it's just, it's a biological thing, it runs in families, which that can be. That's that nature versus nurture aspect. The biological aspect in genes can play a huge role, but the more you look at it, you really have to look at, you really need to look at that trauma or disconnection, because if you can find that and you recognize that there was one, abuse, emotional abuse, sexual abuse, it can really lead to prominent positive results. I love you all. This is your daily dose of mental health. And this channel isn't just for you all out there, it actually helps me as well. I love you all. Please comment, like, subscribe. We're going to be putting out the natural remedies for meth, five natural remedies for meth withdrawal sometime this week. I love you all. Peace out. Have a good week.